Hi, in this video we'd like to talk about the heavy menses flow and what is actually causing it. So heavy menses flow means during your regular menses, you used to be menstruating at a regular volume that is not too troublesome or abnormal. But recently you've observed that there's excessive bleeding or especially heavy menses flow that you've observed. It's actually quite abnormal. And there are a following list of causes for this that you can actually learn about and then also seek the relevant treatments. Antai Hospital offers treatments for each of these causes. And excessive menses bleeding should always be taken seriously. Even though there are no menstrual cramps, if you notice abnormal excessive bleeding, it usually means there's an underlying cause. And if there is an underlying cause, you want to treat it as soon as possible. Don't wait it to let it advance to a severe, more advanced stage. It might be more difficult now, and then it can potentially affect your fertility, cause pregnancy problems, maybe also difficulty in conceiving. So you want to strike when the iron is hot. So I'd like to talk about a few causes. The first most common cause for excessive bleeding is endocrine imbalance, which means you have an excess of certain hormones, for example progesterone or estrogen, that is causing this endometrium lining to be too thick. That's why during your menstruation, the extremely thick endometrium has shed, causing an excess or increase in menses volume. So endocrine imbalance is actually a secondary cause. A number of different conditions can lead to endocrine imbalance. So, for example, I can name a few. PCOS can cause endocrine imbalance. If you have a thyroid disorder, it can cause an endocrine imbalance. If you have obesity, if you have a stressful lifestyle, if you have emotional instability, depression, all of this can cause endocrine disorder, endocrine imbalance. So proper diagnosis is needed. You'll need to do your blood tests, check your medical history, do a physical examination to figure out what exactly is causing this endocrine imbalance, and then treat it accordingly. So the next cause for excessive bleeding menses is the presence of uterine or endometrial polyps. So polyps are relatively harmless. They don't usually cause any menstrual cramps or any pains, and usually they will actually, over time, they will actually dissipate on their own. They will go away. But for those that are causing excessive bleeding, then you might need to talk to your doctor and then include some surgical intervention. You might need to use some surgery to actually remove these polyps. Otherwise, they might grow more. The third common cause for excessive bleeding is the presence of fibroids. So these types of fibroids that cause excessive bleeding usually are present inside the uterine cavity where there is exposure to the endometrium. Sometimes it can also be within the muscle wall, but it's protruding inside into the uterine cavity. So the bleeding is usually coming from the fibroid itself because of the blood vessels that it carries. So usually it's an indication of the presence of fibroid, and it also doesn't have any other significant symptoms besides this excessive bleeding. So we still need to do a proper diagnosis first before treatment. So treatment is still using surgical intervention, laparoscopy or hysteroscopy to remove the fibroid. And then you can see your menses restored to a healthy standard. The fourth cause is adrenal meiosis. So adrenal meiosis is very distinct because it causes extreme menstrual cramps. If you always dread the coming of your menses because of how painful it is, and it also causes severe and excessive bleeding, it is very likely that it is adrenal meiosis. And this condition is because there's presence of these endometrial tissues within the muscle wall of the uterus. Not only does it cause severe pain, it causes a lot of bleeding. So this also needs surgical intervention. If you'd like to seek pregnancy, healthy pregnancy, even conceiving, you will need this condition treated because it can be so severe that it can affect your daily lifestyle. So treatment is just using 3D laparoscopy and then pinpointing each of these lesions within your muscle walls, within the uterus, and removing them. all of it once it's removed, and then you can see your menses is restored and your menses pain goes away. The fifth cause is endometriosis, very similar to endometriosis, but it doesn't bring severe menstrual cramps. Although there is some menstrual cramps that you might experience, not as severe as endometriosis. And these types of this condition means that the tissue is displaced into several different locations, for example, the fallopian tube, the ovaries, the pelvic cavity, several places, and can cause some menses pain and also excessive bleeding. So for this condition, very similar to adenomyosis, you want to use 3D laparoscopy to remove these displaced tissues, and then the excessive bleeding can also be stopped. The final two causes are quite rare, but also something that we need to consider. So the sixth cause is actually presence of cancer, cancers of the uterus, cervix, or the ovaries. So these types of cancer can actually cause excessive bleeding due to the presence of these cancerous tissues. And what we want to do is actually properly diagnose first. According to what kind of cancer, we need to rule out each of these possible cancers before we recommend proper management. The final rare cause is STI. This is not that common, but it can actually cause some excessive bleeding during menses if you have a chronic STI that you have not managed to get diagnosed and then you left it there for months and months. Can develop a serious infection within the uterine cavity and then cause this excessive bleeding. So you need to actually get screened, get checked regularly. For this condition, we also need diagnosis, and usually it's also very manageable as long as you talk to your doctor. So for all these causes, Antai Hospital offers a full contractual treatment for our patients. Excessive bleeding is never normal. It is actually called abnormal uterine bleeding and can lead to far more severe complications down the line if you do not take them seriously now. You want to strike when the iron is hot. So talk to us if you'd like to receive this type of treatment. If you're unsure what kind of bleeding you are experiencing, although it is abnormal, we'd like to receive some information, we can arrange an online consultation and you can talk to our doctors. Do leave me a comment down below as well.